Folks, welcome to the next press briefing on the e-cigarette. And the great question, is it killing us softly? Or is it our greatest public health opportunity? Now, there's a question for you. We have only 4 speakers. Professor Candelera has decided to sit this one out, but he's here in case you need him, and he could be quizzed afterwards. I'm going to ask, I'll tell you who the speakers are, but you can see already because they've got their names on the platform. I think I'm going to ask Wilson Compton to actually kick this thing off and tell us what it's all about. And then I'll introduce the other speakers one at a time.
Sure, I'm Wilson Compton from the National Institutes of Health, the National Institute on Drug Abuse in the US. What compels us to be interested in this topic of e-cigarettes is the public health concerns around tobacco use. It is estimated that approximately 100 million persons lost their lives early in the 20th century due to tobacco products globally. And in the 21st century, it is estimated that over 1 billion persons will lose their lives early because of tobacco products. This makes it essential that we look for alternatives to this deadly product. E-cigarettes, electronic nicotine delivery systems, as a way to deliver the habit-forming but much less dangerous product of nicotine, represents a very promising approach if it takes the place of tobacco products. If it's added to tobacco products, the benefits will not be nearly as apparent. And that, after all, is why we think we need tremendous amounts of research to understand how e-cigarettes are used by the public, whether they will be a replacement and really meaningfully move the population rates of tobacco use, or will serve as a crutch that keeps people hooked on tobacco products overall. That's a key public health question that, among others, we will be funding research to help address.
Thank you very much. Sudhanshu Patwaran is the Senior International Engagement Officer of Nico Ventures Media. Sue.
Hello, I'm Dr. Sudhanshu Patwaran. I work at Nico Ventures, which is an innovative alternative nicotine products company. It's a wholly owned subsidiary of British American Tobacco, but it's separate to the tobacco business. With an average smoking prevalence of 28% among adults in Europe, smoking is easily the most preventable cause of smoking-related mortality and morbidity in Europe and around the world. Electronic cigarettes can be a game changer. They are a disruptive technology just by the fact that they deliver nicotine in a relatively cleaner form without the accompanying smoke. And as we all know, it's the smoke from tobacco that causes smoking-related diseases. And nicotine by itself, as we heard already, is not the real problem. Delivering nicotine in a quality-assured, safety-assured way would be a good thing for consumers and would also assure regulators around the world that this can be a gateway out of smoking for the millions of smokers out there and can be a huge game changer in public health in this century.
Thank you very much. Deborah Arnott is the Chief Executive of Action on Smoking and Health, known affectionately in England as ASH.
Yes, we're a British NGO. Thank you, Wilson. Set up by the Royal College of Physicians in 1971, and our role is advocacy, networking and information. And we're funded by British Heart Foundation and Cancer Research UK, the 2 big heart and cancer charities in the UK. We've done quite a lot of research on e-cigarette use because once we spotted that these products were growing rapidly, we've always supported harm reduction, which is that smokers should have access to alternative products to reduce the harm that their smoking's doing to them. Because as Michael Russell said in 1976, it's the smoke that kills you, not the nicotine. And I think what we've seen in the last couple of years is that electronic cigarette use in the UK has tripled from around 700,000 to over 2 million users. And that compares with the number of smokers at around 9 million or so currently. So it's a significant level of use. And as use has grown and as advertising, promotion and sponsorship has grown, there's a growing concern amongst the public health professionals that this could be a gateway into smoking. Now, we support regulation, but we support regulation which will maximise the benefits and minimise the the risks of electronic cigarette use, particularly now that the tobacco industry is moving into this area. And we know that the tobacco industry's interests really lie in enabling electronic cigarettes to sustain use of smoking and not really to lead to the ending of what has been a massive profit-making enterprise for the industry. And it is the most profitable consumer products industry there is. So what do I mean by maximising the benefits and minimising the risk? Well, what I mean really is that that the regulatory framework needs to support quitting. It needs to encourage switching and discourage relapse. In other words, that smokers using these products would then go back to smoking. And on the other hand, it should discourage uptake amongst youth and amongst never smokers, because electronic cigarettes are a hell of a lot less risky than smoking, but they're still more risky than doing nothing, and it's an addictive product. We don't want to encourage new people to come in to using an addictive product. The regulatory framework within Europe is going to evolve very rapidly. By 2016, when the Tobacco Products Directive comes in, there will be a trim-track approach. So products will either be regulated under the Tobacco Products Directive, or they can opt into medicines regulation. We're working hard in the UK to try and make medicines regulation fit for purpose, because we think there are added benefits to medicines regulation, benefits for e-cigarette users who we know from our surveys want to be assured that their products are safe and effective. But we need to make sure that that regulation doesn't discourage innovation. We think that it is perfectly possible. I mean, there is a good hypothesis that regulation, if applied appropriately, can actually encourage innovation and reduce costs. But it has to be applied appropriately. And as yet, it remains to be seen whether that will be the case. There are products going through the licensing process. They're going to be coming out the other end fairly soon. The first products will be tobacco industry products. And I think that makes it even more important that regulation is appropriate, and regulation in particular of marketing is appropriate and discourages uptake or doesn't encourage uptake amongst young people. I have a great worry that round the world the regulatory framework is very unclear, that many countries are already moving to ban electronic cigarettes, when I think the evidence certainly from the UK is that these products can help smokers quit, and that actually in recent years we've seen, with the growth in electronic cigarette use, a decline in smoking prevalence both amongst adult and amongst youth. And an increase in success in quitting and an increase in quitting attempts. And all of that is positive. And we don't want to see that undermined going forward, because, as Wilson pointed out, we killed millions in the 20th century. In the 21st century, we'll be killing billions if smoking's allowed to continue the way it is now.
Thank you very much. Professor Thomas Harting holds the chair for evidence-based toxicology at, I'll give you the short version, Johns Hopkins University. And over to you.
Yeah, the elephant in the room is the safety of these products. Is it close to cessation, or is it closer to continuous smoking? And my main point was, if you want to hinder these products to get to the market, you do extensive testing in a classical style, as we do for drugs and other type of products. Because these are methods meant to exclude risks, and we know that these products have some risks. I gave the example in the talk, coffee. 31 ingredients of coffee have been tested for their potential to produce cancer in rats. 23 of them were positive, so some 71%. If we use this test, we can easily show that e-cigarettes are producing cancer. This is nothing which we really want to do, so we need a different paradigm of assessing this. Other areas of product safety are moving in the very same direction, but especially in Europe, we don't have any coordinated way of moving safety sciences. So I think we really need to create structures where outside of the tobacco industry, so not biased by their needs and desires to demonstrate safety, we get a fair assessment. Because we can simply not wait 10 or 20 years until epidemiology or clinical trials tell us whether we really were on the safe side with our decisions.
Thank you very much. As usual, please state your name and please wait for a microphone, and it's Christina Reed right at the back.
Christina Reed, freelance, and I was wondering, this whole industry as it's come up, how much does it have ties to the tobacco industry, and how much of it is its own independent industry? And are there entrepreneurs that are making their way through this? And then as a secondary follow-up question to that, how much of a black market do you see as well? Because I've seen some stories on that.
Sorry,
as
a
well.
black market in cigarettes or in...
In e-cigarettes,
Yeah,
because
e-cigarettes, yeah.
apparently they can be very expensive if you buy them in the shop, but then there's some that are a little bit easier to get but not regulated.
Who would like to take that one?
Well, I'm not going to be able to provide a full history at all. Certainly the origins were not in the tobacco industry to begin with, but I'd be curious what my colleague says about the changes even in his company as it's been purchased by a big tobacco company. Some of the issues around black markets and others depends on the regulatory system, and it varies so much across the globe that you'll find very different answers depending on where you go. There's no particular reason for a black market in the U.S. At this time because we don't have a regulatory system for these products and we haven't limited their sale yet, unless they make health claims, in which case they would fall under the medical device, medications and device regulations.
So just to add to that, Christina, the industry evolved as small independent players across the world and importing products from China. What's happened in the last couple of years is consolidation, essentially by acquisitions from big tobacco companies. And the BAT Group, due to its commitment to tobacco harm reduction, went into electronic cigarettes and acquired CN Creative, a UK Manchester-based company, because of the promise that the e-liquid, which is the nicotine formulation that goes in the liquid, would be made to pharmaceutical-grade quality. So there is a move now with the consolidation that people like us, companies like NicoVentures, are trying to raise the quality standards and address some of the concerns raised from a toxicological point of view. We have a massive R&D that can be used and leveraged for actually delivering the right quality assessment so that we can give confidence to the consumer that this is a quality assured product that you can consume.
Deborah.
This is an evolving and new market. I mean, I remember the first product on sale in the UK was in 2007. It was launched in Gala Casino in central London by a tiny, rather sleazy company, which had a DVD ad for the product showing a couple in a bar looking at each other using the product, ending up in bed together. And I mean, I beggars belief, really. And the person, they had a D-list or E-list celebrity promoting this product who kept trying to say, it's fabulous, it's helped me quit smoking. And they kept saying, no, you mustn't say that. You're not allowed to say that. Because, of course, that would have made it a medicine. And over the years, you know, to begin with, most people in the public health community didn't think these products were going to take off. By 2009, 2010, they'd begun to take off rapidly. Since then, I mean, the growth has grown exponentially. We thought the pharmaceutical industry would move in. They've not been interested at all. They don't see, at senior level, I think they see the risks in moving into selling an addictive substance for long-term use are far greater than the benefits. So the tobacco industry has moved in because it's worried this could be its Kodak moment. And the sort of consolidation you always see with a rapidly expanding market is what we've seen. So previously, the product was invented in China. Small companies saw the potential, set up to import products from China, sold them, started to grow, and then other companies moved in and bought them up. And that's what we're seeing in the UK, and we're seeing it elsewhere as well. And we will see further consolidation as the market grows. And I think we're seeing the classic 80-20 rule that, you know, there are a few really big players that have, at the moment, still a relatively small part of the market, but it will grow, I think, as time goes on.
Thank you. The questioner right in front of, and then immediately afterwards, David Levine.
Ilgons Vilks, popular science magazine Terra. E-cigarettes can be used in non-smoking zones. How this can change the habits of smokers, and what are the risks for non-smokers? Thank you.
Right. What are the risks for non-smokers? Who would like to answer that?
We don't yet know the risks to non-smokers, the risks of particularly secondhand exposure to nicotine. Exactly how much gets into somebody who stands next door to somebody who smokes is not yet known. Those are the exact kind of studies that we're funding right now and hope to bring you answers within a year or two. The question as well would be not just the nicotine exposure to bystanders, but are there any other chemicals that are released that could be toxic to bystanders? The lack of consistency across the products creates another real wrinkle and a difficulty in this area, in that it may vary from company to company and from product to product.
There's some studies which show that particulate matter is increasing, that NO, so nitric oxide, and some aluminum and iron is found in the air, but these levels increase about by 20% over the background. So it is not a dramatic increase, and seems to be far less of concern on first look compared to sighthand smoke from a real tobacco product.
David Levine, and then you, Clive.
David Levine, freelance. Exactly what are the risks of this? And also, Nicorette is proven to be pretty helpful to people to quit smoking, but this product doesn't seem to be designed to help people quit smoking. As it seems to be just a better, a more less risky way of smoking.
Assessing the risks is why we're conducting research right now. There are both short-term risks, which can be assessed fairly quickly in terms of the acute effects, and then there might be the longer-term effects in terms of long-term lung health and cardiovascular health, which of course is the areas that we would look most closely. Some of those studies may take a long time. That's what Dr. Hartung was reminding us, that we're looking for early markers of those problems so we don't have to wait 10 or 20 years to detect any long-term potential harms. One of the issues is that the way the nicotine is administered in an e-cigarette means that it has a much more rapid uptake and a much more rapid entry into the central nervous system. This may be why users of tobacco like it and are switching in large numbers. But it turns out they're not switching universally. Not all tobacco users find it to be an acceptable or alternative. And so that's why there's room for a lot of improvement, both in the product and in understanding the health outcomes.
Deborah.
Well, it's not smoking, it is vaping, and I think it's important to note that people are not inhaling smoke, they're inhaling vapor, which includes propylene glycol and nicotine and some other things. But in terms of relative risk, if tobacco's up there, electronic cigarettes are much nearer nicotine replacement therapy products, but not subject to the same quality controls as yet. On effectiveness, there's a good population-level study done by Robert West in the UK, the Smoking Toolkit study, which seems to show that at population level, and that covers a whole range of different products, and it's cross-sectional, and it's not a randomized controlled trial, but it's large numbers, that electronic cigarettes are about 60% more effective in helping people quit than Nicorette or other nicotine replacement therapy products. And we think that there are a range of reasons for that, but one is just the simple fact that it's much more similar to smoking and that hand-to-mouth behavior, and that makes it easier, because it's easier to switch a behavior than it is to extinguish it.
Questioner here, and then Clive, and then Christina again.
Sini Silvan, freelance journalist. You said that in many countries they are banning e-cigarettes, but in which countries?
I can't give you a full list, but the countries I can mention are Brazil, for example, Hong Kong, Malaysia, Turkey, United Arab Emirates, an increasing number of countries. In Canada, you can use them for personal use, but they're illegal, but they're on sale quite widely. It's a really confusing mess, really. South Korea, they're legal but heavily taxed. In Australia, it's very confusing. I couldn't describe it accurately, but it's largely you're not meant to be buying them, So I think it's all over the place. In Europe, there will be a system in place, but how it will work remains to be seen.
Clive.
Even in the U.S., we're seeing variations across our jurisdictions. So at the federal level, we don't have regulations yet. We have a proposal to begin the regulatory process, but there are different cities that subject them to the clean indoor air rules and restrictions similar to smoked tobacco products. So we see variation within the US based on local jurisdictions.
Just to add to the range of countries where there's a very wide variety of regulation and in some countries banning, Malaysia is a good example where the Ministry of Health is looking at wanting to regulate e-cigarettes. They have not done anything about it, but the interesting fact is there are about 300,000 users of e-cigarettes already in Malaysia. Now that's a massive number for a country that size. And any regulation that comes in, either helped by the public health community globally and the Western world particularly, should inform governments in countries like Malaysia and elsewhere in the world that it has to be balanced. It shouldn't be so onerous that it'll kill the category and then go underground, which will be even worse for consumers. And just expect that and put regulation in place that allows manufacturers to raise the quality standards in the right sort of pace to meet consumer needs. And of course, if this is a product that's for smokers to switch out of smoking, it would be a logical thing to support with regulation and not oppose with regulation. So that's a very key message.
Thank you. Clive? And then Christina again.
Thank you. Clive Cookson from the FT. I wanted to ask Wilson, you've mentioned 2 or 3 times the research that your institute is sponsoring. Perhaps you could sort of outline briefly the whole range of that research and how much is being spent and what's being done, and whether that's, as far as you know, the sort of biggest science-based attempt to find out what these products are doing.
There are 2 sources of support for tobacco-related or nicotine-related research in the United States. The National Institutes of Health supports one portion of it, and that's supported both in the National Institute on Drug Abuse, the National Cancer Institute, the National Heart, Lung, and Blood Institute, as you might expect, given the aspects of addiction, cancer, and lung disease related to tobacco products. But the newest adventure is that the Food and Drug Administration now has been given regulatory authority over the manufacture and marketing of tobacco products, and they have undertaken a large-scale research program. They are working with a number of partners. They work with the NIH, among others. They also work with our Centers for Disease Control and Prevention. But a large amount of research is conducted on behalf of the FDA by NIH. So they transfer their funds to the NIH, and then we develop and launch grant programs in this area, taking advantage of our research infrastructure. For instance, we have a large-scale population assessment of tobacco and health. It's a single longitudinal study with a budget of over $200 million in the first 5 years. We expect this to be a long-term venture, but the first 5 years are already quite significant. There's a second large-scale program, the Tobacco Centers of Regulatory Science, which is about $50 million per year. So in a 5-year period of funding, well over $250 million as well. This just gives you a sense of the scope and range of investment to try to increase knowledge. What you're hearing around e-cigarettes is just an example of the remarkable lack of information. This is a place where the public has started doing something without regard to whether we had research on it or not. People made their decisions based on their own behavior and their own ideas, and we are trying to catch up with science at this time.
Thank you. Christina?
Yes, on that note, are you going to be doing the research primarily in the United States, or is there an international involvement as well? And then a secondary question for Deborah is, do you think that there needs to be a different term for e-cigging, like e-cigging or vaporing or something, so that it counters the idea that you're actually smoking?
For US-supported research, we face 2 different sets of regulations. The NIH-supported research includes a significant international component. For instance, our Fogarty International Center supports tobacco research programs in many developing countries. It's one of our main investments in international research would be the tobacco area because of the tremendous public health needs. On the other hand, the way the FDA Center for Tobacco Products was launched, they are not allowed to fund international work. So there is a difference depending on the legislation and its source in the US.
Dr. Hartung.
I think we should understand that the environment is completely different on the US and EU side. On I'd like to characterize this as a top-down and a bottom-up approach. In the US, we have very much top-down research, which is led by agencies which are heavily engaged in revamping science and in finding new ways of regulating. We don't have any equivalent of this in the EU institutions, where the EU agencies are essentially executive and they're not promoting novel science. And where research into new aspects is only funded in a bottom-up approach, by giving money to researchers. And here in the tobacco area, this is extremely poor. There's not very much being done in comparison.
Deborah.
I think that's a really important question. And actually, if you look at what people who use these products are calling themselves, they've already moved on, because largely they talk about vaporizers, vaping, and refer to themselves as vapors. And the products that are more commonly used by long-term users are decreasingly looking like cigarettes, which I think can only be helpful, because a lot of the hysteria around electronic cigarettes is because they're called cigarettes and because they look like cigarettes. So yes, let's call them vaporizers and vapors and vaping, all to the good.
Dr. Patwadin.
Christina, just back to the R&D spend. BAT Group has been spending about nearly over £100 million annually for the last 8 years on research and development in the harm reduction space, which is trying to find, discover, and work on products which are less risky than conventional tobacco products. Now, more of that money is going to be diverted and focused on e-cigarette research in the next few years. It was also the money used to acquire companies in the last couple of years to sort of build the portfolio of e-cigarette technologies in the company. So there is a lot of money being spent on research within the industry. But of course, being able to do that and then publish that is a huge challenge, because many journals nowadays don't allow research coming from tobacco industry-funded companies. So there's a challenge there as well.
For a very good reason. The history of tobacco industry research is not a glorious one. And I think it's terribly important. You know, I look to America and the amount of money that's going into research in this area with an enormous amount of jealousy, really, because in the UK and Europe there is much less research, and the research is much less coordinated, and that is a real problem in this rapidly expanding area. But I think there will be a lot we can learn from the research that's being done in America, and what we need to do is be clever. We may not have the multi-million-dollar budgets, but we need to make sure the research we do is focused, and that it's not led by the tobacco industry.
The source of funding for our tobacco research out of the FDA is the tobacco industry itself. So these are user fees levied against the tobacco industry, but then it is administered by neutral parties, and that's the model that we're using. And I think others could consider a similar model. Even though the FDA isn't allowed to do research internationally, they certainly share information with all the international regulatory groups and tobacco control community, because we share a goal with the international community to reduce the health burdens associated with tobacco as best we can in the future.
Question on the far side of the room.
Christoph Behrens, Süddeutsche Zeitung. Are there preliminary insights into how many people who switch to e-cigarettes actually succeed in quit smoking, or whether they just develop a new addiction for e-cigarettes?
From the UK, certainly our studies are cross-sectional, but we've been looking now at fairly large sample sizes over the last 2 or 3 years. And as use has grown, the success rate has remained pretty similar, which is that for every 3 smokers who try electronic cigarettes, only 1 finds them satisfactory enough to carry on using them. And for that 1 person, 2 out of 3 carry on with dual use, and 1 out of 3 roughly ends up quitting completely.
One interesting thing that we've done in the US is our American Psychiatric Association recently revised our psychiatric nomenclature. We just changed the DSM-4 to the DSM-5, and that was launched about a year ago. One of the important changes was to change the disorder from nicotine dependence to a tobacco use disorder. So we want to de-emphasize nicotine as the substance related to addiction and emphasize that the harms and problems are the tobacco itself.
So would you call that a success? Would you call that a success if someone just keeps using the e-cigarette instead of quitting completely?
As a physician who deals with addiction, my goal would be to help people move to a full recovery, but I'd be extraordinarily gratified and pleased to see people give up their smoked tobacco products for another form of nicotine. That would be a tremendous success in almost anybody's book.
Yeah, Deborah.
I think that's really important. I mean, e-cigarettes, in terms of safety, are much nearer nicotine replacement therapy. You can carry on using nicotine replacement therapy for the rest of your life. The same is pretty much true of electronic cigarettes. There may be some marginal health impacts, but relative to smoking, it's so much safer. So switching completely is not a bad thing. It's a good thing. The thing we know is that actually most smokers, want to get rid of their nicotine dependence altogether. So they would like to use electronic cigarettes as a stage on the way to quitting, and we need to help them do that. If they carry on using, fine. If they don't want to carry on using, then they should be helped to stop.
I think Deborah had one more question, and then Clive. Actually, why don't Clive and then Deborah? Since
What arguments do those who are not represented here today, who are really opposed to e-cigarettes on public health grounds, have, apart from the gateway argument that it normalizes smoking? That's put persuasively, and one can argue about that. But are there any other medical reasons that you've heard that we should be thinking about?
I'd say there are three. One is the gateway concerns that we may induce adolescents or young people to start with these lower risk nicotine products and then switch to tobacco over time. The second is that there may be an incomplete quitting, so that people use these electronic cigarettes or vaping products at times when they can't use tobacco but really don't make the effort to quit and they would have otherwise. The third reason is a more speculative, that we don't completely know what is released by these products. So understanding the toxicology, although it certainly appears to be much safer than tobacco products, turns out we don't have that much information. So that as the liquid boils out of the little devices and you're left with a little bit of metal and some remnants, what is being released? And if you do that over and over every day, what is the exposure of individuals? That's the third argument that I've heard. I wasn't sure. Deborah may know some other.
So don't you? Oh, sorry. Sue and then Deborah again.
Sure. Now, just to add to the third point, actually, there are concerns about what is in the product, not only what is in the vapor that comes out of it. And that's, again, where the smaller companies who are selling it it's a business that's sort of grown out of a garage, have to then realize that they are actually selling a consumer good. And you wouldn't expect that with any other consumer good out there. Quality standards have to be there, have to be raised and managed and maintained, and be answerable to the consumers and regulators. So that's a big gap, and I agree with that with Wilson, that may be an area where a lot of stakeholders can play a role to sort of raise that bar and ensure quality.
Deborah.
I mean, nicotine is not a good thing to start with. Yeah, I mean, it has some implications in cancer. It is a developmental toxicant, so damaging embryo development, and it is also acutely toxic. There's some concern that a baby could be killed by the content of nicotine in one of these containers, which is an engineering problem, but it is not different also to eating some cigarettes, which also would kill a kid. And it is really about a lot of these unknown substances. We have 4,000 substances in cigarette smoke, but there's certainly many of these plant extracts are a couple of hundred substances too, and very little is known about them, and especially not about this type of delivery into the organism.
I think a lot of it isn't about the science, and one has to go back to the campaign against smoking and tobacco and the history of it, and people working in public health, and the behaviour of the tobacco industry, which has been appalling over many years. They lied about smoking killing people, they lied about smoking being addictive, they've made billions of dollars out of selling a legal product which kills people, kills half of all users. And people working in public health on tobacco control had 3 real aims, and those aims worked together for many years. And the aims were, first and foremost, to reduce or eliminate the harm caused by tobacco. But the subsidiary aims, which were just as important, really, were to destroy the tobacco industry and to get rid of addiction. And those 3 objectives went together, but they do no longer go together in the same way, because actually, if harm reduction and if electronic cigarettes are a solution, then you're saying that the end of addiction is not nigh, and that for some people is unacceptable. And there are some justifiable reasons for that. I mean, as Thomas points out, addiction isn't in and of itself a good thing, even though nicotine is a relatively harmless substance to be addicted to compared to many others, like alcohol, for example. But also, if people are heavily addicted to something, that means they're going to be spending money on it year in, year out. And the most heavily addicted smokers currently are the poorest, most disadvantaged people in society. And do we really want them to be spending significant parts of their income on something that's not productive? And then the tobacco industry, I think a lot on our side, it sticks in their gullet that the tobacco industry are moving into this. I've had people say to me, do you really mean that we're going to see the industry move into this other area and carry on making the obscene profits they made in the past by selling addictive substances, only they'll get away with it now because these products won't kill people? And, that's an understandable position. I don't think it's acceptable, because I think, and actually within the UK we had a big debate over 10 years ago, and the broad majority of the public health community accept that the primary aim must be to reduce and eliminate the harm caused by tobacco. And we've got to stick to that. And the other aims are, marginal. And if we can no longer get rid of addiction completely, if we can no longer destroy the tobacco industry, well, if that's, as a result, we're going to save millions of lives over many years, then that's got to be worth accepting.
I'd like to end on that note, but I think Christina has one very quick question.
If you were to just do a comparison on frequency of use of a product and tell me what's the most dangerous tobacco product and how does that chart go down in terms of risk?
There's an interesting paper by Professor David Nutt, and I can give you the reference after this, which was published earlier this year. And in that, 12 of the top tobacco, nicotine policy and ethics experts came together in London and used an approach that they've used for drugs in the past to rank products, to your point, to rank products on their risk. Now, what they've done is they've looked at the harm caused by a tobacco or a nicotine product to the individual using it, but also to the society on the use of that. So you can think of passive smoking as an example of harm to others or economic harms. And in that, they found that cigarettes were, of course, top on the rank on a spectrum. On the right, where there's 100, that's where combustible conventional cigarettes lie. And you come down that spectrum, you have about number 4 rating for an electronic cigarette, and very comparable to an NRT, which is a point or two below that. So that's the wide gap and valley between combustibles and nicotine products delivered like that, and which is very logical. But it's good for them to say that, because that means that scientists are slowly agreeing with this sort of idea.
Wilson?
I will point out that those are opinion polls from experts. So what we would like to see is hard science to really be brought to bear to address these risk factors. And we just don't have the answer to your question in any significant way yet.
On that, okay, right.
Just very quickly, because I don't want to imply that I don't think regulation is necessary. There is not evidence of a gateway effect at the moment. And it's really important to note that amongst adolescents, multiple risk-taking behaviour is something that, if you are going to be starting to smoke, you're also likely to engage in unsafe sex practices, you're also likely to drink, you're also likely to try illegal drugs. So you're also likely to try electronic cigarettes. That's not evidence of a gateway effect. Evidence of a gateway would be if we saw suddenly, we've seen declines in youth smoking in the UK, if suddenly that turned around and we saw it going up again. But just because it hasn't happened so far doesn't mean it couldn't happen, and regulation has to do all it can to monitor and respond to any risks and deal with it, because we don't want to see large numbers of young people who would otherwise not have taken up smoking, taking up electronic cigarettes and moving on to smoking. And as the products evolve, there could be more of a risk, because at the moment they're still pretty early in their stages of development and they're not pretty effective. They're not really effective. They're nowhere near as rapid in their delivery of nicotine as cigarettes, and as a result, they're much less addictive.
On that note, which was basically a reiteration of the things we don't know, I'll bring the press conference to a close with grateful thanks to all our speakers. And thank you very, yes, please do.